So let's put him in hook lying position. And let's find neutral. How do we do that? Pelvic clump. So down to 6, anterior tilt, up to 12, posterior tilt. Let's settle somewhere in the middle. Down to 6, not so far. Up to 12, not so far. You just settle into that centered position where he has a neutral pelvis. What's a neutral pelvis? ASIS on the right, in line with the ASIS on the left, so it's not laterally tilted. And the two ASISs in the same plane as the pubic symphysis, with a slight lumbar lordosis. Not excessive, not flat. That is basically neutral. So we've established that first. Now we have to activate the core muscles. So we're first going to go with the pelvic floor. And there are lots of ways. These are Kegel exercises, There are different ways of getting people to feel this. You could have simply, people say, imagine you are urinating and you're going to stop the flow of urine. Or you can have a male, if you're not uncomfortable with it, lift the scrotum up. That's one way to do it. With females, squeeze down on the tampon. And that's how you do it. So different ways to try to get this. It's a little uncomfortable, but we're health professionals, doctors of physical therapy. We've got to get over the discomfort because we're trying to help our patients. So we set the pelvic floor. Okay, get that set? Good. Next thing we want to do is we want to bring in the transversus abdominis. Not so easy to get this. There are different ways to get this. Let's try a few. We're going to have you palpate the ASISs. I want you to, on exhalation, to indraw your belly button to your spine. You're going to breathe in through your nose, breathe out, pursed lips, and as you breathe out, I want you to indraw the belly button to the spine, navel to the spine, without doing a posterior tilt. So your hands are here to make sure that you're not moving your pelvis. This is a movement of the abdominal wall. It's not a movement of the lumbopelvic area. And it's sucking in on inhalation. That's the way you do it on exhalation. Now I'm going to palpate inferior and slightly lateral to the umbilicus. And I'm going to see if I'm feeling a TA contraction. Breathe in. Breathe out through pursed lips. Pull the navel into the spine. There you go. He's got a nice transversus abdominis. It narrows the waist. We know that synergistically, when you fire the TA, you also bring in the multifidi at the same time. You also bring in the respiratory diaphragm and the pelvic floor. They all work together as a unit. So let's start again. Relax. Let's find neutral. 6 o'clock, 12 o'clock, less 6, less 12. Settle into neutral. Neutral pelvis. Good. Palpate here. I want you to, on exhalation, indraw the abdominal wall in towards the spine. Breathe in. Breathe out and indraw. There he goes. You feel the TA coming in nice. Hold that and just breathe normally. First thing we're going to do is we are going to start to work away from the core with functional neutral lower abdominal training exercises. We're going to set the core first, then we're going to work from there. So we're going to start with the heel slide. I want you to maintain your neutral and maintain the core contraction. And I want you to slide this foot down, counting backwards from 5. And the weight of the leg is going to want to arch your back, so don't let that happen. You maintain neutral. This is starting to work his not local system. We've activated the local. This is now starting to work his global system, his torque producers, his obliques, and his rectus abdominis. Again, down from 5. You can do it on exhalation. Count backwards, and don't let your back arch. Good. And then we do the left. Breathe in. Keep your core stability. Keep your neutral, and do the heel slide on the left. Good. The thing we can do is have you set your core. You're going to heel slide, and now you're going to lift your opposite arm at the same time. As he brings his arm up, the back is going to want to arch. Don't let the back arch. So these are movements that challenge the core, that disturb the core, perturb or perturbations of the core, and you've got to maintain your neutral with an isometric contraction. Starting deep and working out, kind of like the heart, right? Terry talked about the myocardial contraction starting in the endocardium and working its way out superficially. We're starting deep in the core and working out superficially from there. So now what you're going to do, neutral, pelvic floor, TA, and now slide left and raise your right arm and don't let your back arch. Good. Do it on exhalation. Ready? Try again. Ready? Go. Breathe in and out. 5, 4, 3, 2, 1. Don't arch. Good. He does 5 of those, and now switch. Right leg, left arm. Breathe in, breathe out. Separate them. The back is going to want to arch. Resist that tendency by maintaining a good abdominal contraction. So when he does this, he is bringing in his rectus and his obliques, but only after setting the deep system first. Okay? Next thing we can do is some leg lowering. Raise up. Set your core in neutral. Lower the right. And back up. And now lower the left. And don't let your back arch. Good. Keep that neutral core contraction. Good. And then we do ipsilateral. This is all in the book. Hold here. And now separate. Good. And switch. Good. Some people refer to these as dead bugs. A dead bug on its back, and before it dies, it croaks and does some kind of crazy thing. They called these back in the day dead bug. Do this.
No, left.
Yep, like that. That's it. Ready? Go. There you go. Nice. We can mix it up a little bit.
He looks like a dead bug.
And don't let your back arch. Good. And then we can do, this is now really, this is, look, it sounds a lot easier than it is. It looks easier than it is. You can both up. Now bilateral leg, neutral, hands down, maintain TA, and now bilateral, and don't let your back arch. This is very difficult. This may take a month or so for a lot of back pain patients to do. Lower, don't let your back arch, breathe out. Good, keep your core contraction. And the last thing you do is arms, oh, there's the animal. And now separate them at the same time, arms and legs. Good. And together. Touch your knees with your hands. Good. Breathe in and out. Good. And that's tough. A lot of people can't come close to doing this for a long, long time to maintain that kind of stability. And then once they're good at that, you can make it a little harder.
You know you work out.
And this is really no crunches where you're not loading the spine in flexion. You're maintaining neutral, and you are really challenging these abdominal muscles. Nice. Okay. Try the slides, the heel slide, opposite. Slide here and raise your left arm up. Just like this. Good. Back. Put down. And now slide your right heel. Good. And now back. Good. Hand back. Again. Left arm, right leg. Slide. Good. Keep your neutral. Good. If you want to make it really hard, you have them lift the back of their head off the table by ½ an inch and tuck your chin. And you get the deep neck flexion at the same time. That's really tough. You're getting the whole core from the upper cervical right down to the pelvic floor. Ready? Go. Too far. Just ½ an inch. Good. Left arm, right leg. Good. Back up. Good. There you go. Put your head in. Right arm, left leg. Same time. Breathe in. On exhalation, breathe out. Good. Okay? And then you can do right through the whole sequence. Bilateral. So, in these. To maintain neutral, you can use a stick like this or a dowel. So let's bring you down a little bit. Lift this from your head. A little chin tuck. Good. So we want to maintain neutral. This is the way to get the TA if people can't get it in hook line. Relax your belly into my hand with a little pre-stretch. Breathe in through your nose, out your mouth, and now pull your belly away from my hand without moving your spine. He's good at it. Most people have a hard time. Good. And relax. Good. So we have neutral. Drop down a little bit. Good. Give me the pelvic floor contraction. Stop the urine flow. Pull in the TA. Good. Now we work around the core. Maintain neutral. Left arm, right arm. Good. Maintain neutral spine. And now left arm, right leg at the same time. This is hard to do. When they extend the hip, most people, they want to arch their back. You've got to bring in those abs now to prevent that. Try that again. Let's do it without the arm. Bring your leg back. Don't arch your back. Dissociate the hip from the back. Very important movement. And down. Let's try the left leg. Don't let the back arch. Keep your stability. Keep your stability. Don't know you're arching right there. You're going too far. Now, if the hip flexors are tight, you've got to stretch them out because this is really reprogramming. This is training. And if there's stiffness, you're not ready. If that psoas is short, it's going to pull him into an increased lordosis. We want him to train his abs rather than be working against a tight rectus. So you work on all the structural things, then you work on this. Okay, left arm and right leg. Mark, you want to come up and do a little work on the ball and on the foam roller? Sure. So then, the next thing you would do is put the person on an unstable surface. I gave you a little handout on that from OPTP. And then they bring in a lot of nice reflex mechanisms to try to stabilize when they feel intrinsically unstable.